you want to know why your vet bills have gone up so much? Well, one important factor is that for the last, 30 years at least, the veterinary profession has been driven by the idea of offering clinical excellence. If you look at the websites of the 6 main corporate veterinary groups in the UK, they're all about offering excellence, and the same idea permeates the independent sector too. So what does that mean? Well, in any medical situation, there's almost always a range of diagnostic and treatment options. And for obvious reasons, vets have leaned towards offering whatever they think is the best clinical care for the animal in front of them. Now, there are lots of ways of defining that word best, and it can vary, even between 2 vets at the same practice. But I think most would agree that it's the option that offers the best chance of a successful outcome for the patient. Now that's all well and good, except that if you want to increase the chances of a successful outcome, it can be argued that the patient now needs a plethora of diagnostic tests, not to mention MRI scans, increasingly sophisticated surgery, and linear accelerated treatment for cancer in a machine that costs over £4 million. So the problem here is that best and excellence are expensive. Now, many in the veterinary profession are starting to realise that it's no good offering excellence if half the population can't afford it. And it's not just a question of whether half the population can afford it either. It's also, dare I say it, about whether they actually want to spend that much on their dog. Now, that's a tricky thing to navigate because there are lots of reasons why you might feel pressure to make sure your pet benefits from the best clinical care. For many, that pressure comes from feeling that the dog is one of the family, that they are a pet parent to a fur baby. Others, probably most of us, feel there's a moral duty of care we owe to animals who depend on us. This can make it feel very uncomfortable if the vet suggests what they think is best and you find yourself wanting to ask for a cheaper option, which may offer a lower chance of success, either because you can't afford it or just because you have other priorities. So what's the answer? Well, I think it's twofold. There is no doubt that the veterinary profession in the UK has listened to what the public is saying about the cost of veterinary care. Hardly a day goes by without there being another webinar or lecture teaching vets the principles of contextual or pragmatic care, both of which recognise that a successful outcome for the dog is only successful if it comes at a price that the owner can afford or wants to pay. But at the same time, perhaps we all need to be less afraid to discuss financial boundaries with the vet right at the outset. Don't be embarrassed to ask whether there's a cheaper course of action, and don't be embarrassed if the cheaper option also carries a lower chance of success. What you need to do is work with your vet to find the solution that offers the best chance of a successful outcome within the limits of what you can afford or want to pay.